Hi, my name is Stefan McClellan, and today I'm going to be presenting to you some information about amyotrophic lateral sclerosis, otherwise known as ALS. In this picture here, we have two of the most notable people known to have the disease, which is on the left, you have Stephen Hawking, and on the right, you have Lou Gehrig. So in this slide here, I'm going to give you a little background information about the disease. And once again, amyotrophic lateral sclerosis, otherwise known as ALS or Lou Gehrig's disease, is a fairly rare disease that has very detrimental and degenerative effects on the body. The disease was first introduced back in 1869 by the infamous and great French neurologist Jean-Martin Charcot. His early work on the anatomical lesions within the CNS included him taking primary amyotrophy and primary lateral sclerosis and combining the two. And when he combined the two, it led to the discovery of amyotrophic lateral sclerosis, which is ALS. Once again, as I said before in the previous slide, the most infamous people to have this disease are Lou Gehrig and Stephen Hawking. Now, to give you a basic definition of what amyotrophic lateral sclerosis is, basically it's a fatal neurodegenerative disorder that has a detrimental effect on the upper motor neurons and the lower motor neurons, and also the neurons that's contained within the frontal cortex. It is labeled as a progressive disease, which means that the symptoms get worse as time goes on, and currently there is no cure for the disease. The treatment for the disease is not very optimistic as well. There hasn't been too good of results with it, and it belongs to a group of disorders that are collectively known as motor neuron diseases as well. So to just describe ALS a little bit, what ALS does is it affects the neurons that are responsible for the control of voluntary muscle movement throughout the body. When this happens, it causes loss of motor control in the spinal cord, the face, the limbs, and just throughout other muscles within the body. Once again, the causes of this disease are not well known, which is why there hasn't been a cure, and which is why the treatment for it isn't too good either. And also the prognosis for it is very short. So the lifespan of people who have this disease is usually within 2 to 5 years. So it's a very rapid disease that has very detrimental effects on your body. Now to talk about some probable causes and etiology of ALS. Technically, ALS can affect any age group, but symptoms are most commonly seen in patients beginning around the ages of 55 and 75. And it's often seen in men more than women in the early stages, but as age increases, the gap between men and women are pretty much the same. It's most often seen in Caucasians and non-Hispanics. In 1993, there was some research done by the NINDS, which is a foundation of different scientists that came together, and they found that mutations in the S0D1 gene were linked with some cases of familial ALS. Then changes in processing of RNA molecules have also been seen to lead to some ALS-related motor neuron degeneration as well. To continue on with the etiology of the disease, in 2011, scientists discovered that a defect in the C90RF72 gene also played a role in the diagnosis of ALS. Environmental toxins, viruses, physical trauma, and diet have also been noted to be involved with the onset of ALS. There has been studies that show that military veterans are 1.5 to 2 times more likely to develop ALS due to exposure to environmental toxins such as lead, and those included in the picture to the side here. Rolling on to the next slide here, we have the epidemiology of ALS. As I said earlier in the presentation, ALS is a very rare disease, but currently it is the most common motor neuron disease seen in adults throughout the world. The incidence right now is approximately 1 to 2.6 cases per 100,000 people annually. The prevalence is approximately 6 cases per 100,000 people annually. The current average age of onset of the disease is 58 to 60 years old, with the survival rate averaging from 3 to 4 years until death, and this could be 3 to 4 years. Some sources say 2 to 5, but just notice between the 2 to 5 years of survival if you have the disease. Between October 19, 2010 and December 31st, 2011 in the USA alone, there were 12,187 prevalent cases of ALS. ALS is split up into two categories. You have sporadic ALS, which occurs 90 to 95% of time, which means this is the most common form of it, and the remaining 5 to 10% of cases that are diagnosed are hereditary and they're termed familial ALS. Once I said before, due to the disease affecting the motor neurons and pretty much taking away your voluntary motor control, the prognosis is 2 to 5 years. So for the newest research, Nudesta is often prescribed to treat the pseudobulbar effect phenomenon, which is very similar to lability of your emotions, which is pretty much if you may have an inappropriate expression of your emotions. So you may cry or be happy or be mad for no apparent reason. Also, Riluzole is often prescribed, and that is currently the only known drug to impact the survival of ALS, and it does this by slowing the disease progression and prolonging life when you have the disease. Oftentimes, people with ALS also take antioxidant supplements, and they just work to improve your nervous system and your overall health. However, in 2017, there was a new drug approved by the FDA named edaravone, which is a free radical scavenger, and it works to just eliminate some of those free radicals, some of those toxins that are built up within the system, and just replace it with the antioxidants. So with ALS, symptoms usually occur in a progressive manner, and oftentimes patients who have ALS have noted that the first sign usually occurs in your hand or your arm, and it leads to difficulty with tasks that requires a precision grip, such as writing or button or tying something. Other signs and symptoms that are seen are fasciculations in the arm, your leg, your shoulder, or your tongue, which are basically just muscle twitches. You can have muscle cramps, you can have spasticity, your speech can become slurred, you can have a nasally speech, you can have difficulty chewing and swallowing. This leads to a hazard with choking or just breathing in general. You can also develop dysphagia with this, dysarthria, or dyspnea, and I'll talk about that later on in the presentation. If symptoms occur in the limbs, then it is referred to as limb onset ALS. If speech or swallowing problems are noted first, then it is then referred to as bulbar onset. So medical and surgical management that are required whenever you have ALS includes non-invasive ventilation, which is due to the diaphragm and intercostal muscles progressively weakening over time. You may also see a tracheostomy being inserted to improve breathing, and this is due once again to the intercostal muscles weakening. And you may also require therapy from a speech language pathologist, occupational therapist, or physical therapist to just help improve quality of life when you have the disease. Some health problems that are often seen alongside with ALS involve dysarthria, which is a weakening of the muscles involved in speech, which can lead to you having a slowed or slurred speech whenever you talk. You can have dysphagia, which is difficulty chewing or swallowing food, and this is due to a weakening of the esophagus and other muscles involved with that as well. You can see depression in the very early stages of the disease. You may also have involuntary emotional expression disorder, which is similar to lability as I talked about before, and you may also see spasticity alongside it as well. Some precautions and contraindications to think about when you have ALS includes an increased risk of falls due to your muscles becoming weaker, choking hazards, which goes back to dysphagia, which I just talked about, breathing difficulties as well goes back with dysphagia. You can have musculoskeletal tissue damage, so you just want to be careful and not apply too much stress to your muscles because they are weaker. So if you apply too much stress, it could cause more damage than what you need to have occurred, which means when you exercise, you have to be sure to avoid high intensity exercises because you don't want to fatigue those muscles too much and end up progressing to disease even faster. You also want to avoid eccentric exercises with resistance training because those cause more damage to the muscles. So you just have to be careful with the eccentric exercises and just be careful when you exercise with ALS in general. Early interventions can help to improve the quality of life throughout the process of having ALS. This can consist of early referral to therapists who have a background in ALS. Most likely the therapy will contain education on safety, exercise, and ways to conserve energy, such as when you walk or just in general to try to keep your energy to a maximum level. You may also have AFOs, which are ankle foot orthotics, recommended to improve safety and to make you become more efficient with your gait. You may also receive education on the expected progression, and this will allow the patient and the family time to plan around the prognosis of the disease. In the past, there has been a lot of controversy involving ALS and exercise due to worry that exercise could damage the muscle tissues and that could lead to a quicker progressive decline with the disease. But more recently, exercise has been noted as an intervention which can improve function and slow the progression of the disease. The research so far has involved resistance training and aerobic exercise training, and the resistance training consisted of a moderate intensity upper and lower body resistance exercise program. The aerobic program involved patients walking on a weight-supported treadmill for 30 minutes, which is broken up into 5-minute segments, 3 times weekly over an 8-week period. And although there has not been enough conclusive evidence to show that exercise improves ALS, the current evidence does show improvements in the musculoskeletal, immune, cardiovascular, and mental health of patients who have ALS.